data management and analysis. My name is Sonia Dublin. I'm with Capacity for Health, and we'll be hosting today's webinar. So we're a capacity building assistance program of the Asian Pacific Islander American Health Forum. We have offices in both San Francisco and Washington, D.C., and we're based in San Francisco's office today. Our program is funded by the Center for Disease Control and Prevention, CDC, to provide free capacity building. And specifically, we do a lot of work providing trainings, webinars, and individualized kind of one-on-one support around a wide variety of topics. Organizational development things like board development, strategic planning, fund management, fiscal development. Also, we do a lot of work around evidence-based interventions and public health strategies, and also a lot of capacity building and monitoring and evaluation. And today's webinar, which is the second part of a three-part series, falls into our monitoring and evaluation capacity building work. Before we get started on the content of today's webinar, just a few housekeeping announcements. Everybody's actually been automatically muted. We will have lots of opportunities for conversation and questions and discussion. You can either click on the raise your hand icon, and we can actually call on you and unmute you so you can ask your question live. Or if you prefer, you can always type in questions in the questions box, which is in the lower right-hand side of your webinar control panel. If you would like to be able to raise your hand and ask a question live, and if you are listening to today's audio through a telephone, please make sure to enter your audio PIN, because that's actually the only way we're able to unmute you and allow you to ask a question live. Also, if you have multiple people from your organization or program sitting around one computer, go ahead and use that questions feature to chat in your contact information so we can make sure to include folks on follow-up. We will be sending out links to a recording of today's webinar as well as the slide set and an information sheet that accompanies the content of today's webinar. So the final piece of housekeeping is that today's webinar is being recorded, and that recording will be available on our website a little bit later today. So today's presenter is Jessica Manta-Meyer. Jess and I have had the pleasure of working together for almost 15 years now. She's got a really diverse background, both in direct service and program management and program direction. She's currently working as a research associate for Public Profit, which is an evaluation consulting firm here in Oakland, California. And she has been developing this whole three-part series for us on data management and analysis. So today, as I said, is the second part of our three-part series. And we'll talk a little bit more throughout the webinar and also at the end of the presentation about how to access part one, which was the basic data management and analysis presentation, and also part three, which is going to focus on sharing data through effective visual representation and data visualization. So without further ado, I'm going to pass off the audio to our presenter, Jessica Manta-Meyer.
Thank you, Sonia. Welcome, everyone. Good morning or good afternoon, wherever you are. I want to also just do a shout out to Peter Neely, who helped me a lot with this webinar. I don't think he's on with us, but you may listen to the recording later. Today we're going to spend some time going over tips and techniques for managing and analyzing data. Here is a quick glance at our agenda. You'll notice the frequent mention of Excel, and I'm going to talk a little bit more about why we're going to look at Excel, in particular Microsoft Excel, in a moment. But first, we did want to get a sense of who is out there with us today. Please take a moment to take the poll online to tell us a little bit about what your experience is with data management and analysis. And this is a select all that apply question, so please feel free to click any or all of those. Very interested to know what experience people have in the whole data management and analysis process. While we're waiting for those results to come in, wanted to talk about Excel for a minute. We are going to show lots of examples and talk about formulas and tools in Excel, specifically Excel 2010 for Windows. We're picking Microsoft Excel because it is a commonly available software. Most people have it. We think that it will be useful, most universally useful spreadsheet software to use to demonstrate the techniques. We are using Microsoft Excel 2010 because it's the most recent version, and some of these techniques work particularly well in that version. If you have earlier versions of Excel, if you're using it on a Mac, if you're using a different spreadsheet software altogether, there certainly are things that many of these tips and techniques you can do in other versions of spreadsheet software. You just might need to check out the help menu to find out where or exactly how it works in the version that you are using. All right, so looks like we've got a lot of people on the line who collect and enter data and participate in analysis and decision-making using data. But everyone, looks like we've got a lot of people doing a lot of different steps in data management and analysis. For those of you who are doing reports and sharing data with others, we encourage you to check out the data visualization webinar in a few weeks, where we're going to really delve into some good ways to visualize data. The rest of the topics we're going to be reviewing or covering today. First, we covered a lot of these topics in the basic data analysis webinar, which is available online as a series of online or as one online training module. We're going to review some of those concepts to make sure that we're all starting out from the same place. First of all, the way you set up a spreadsheet is columns are your different variables and rows are your different records. This will allow some of the formulas that we're going to be using today to work right if you set up your spreadsheet this way. We also want to remind everyone that broadly speaking, there are two kinds of data that you might be working with, two kinds of numeric data. The first is categorical. There's different discrete categories. Gender is categorical. Race and ethnicity are categorical. Then there are continuous variables, which is variables that are sort of on the number line. You can line them up. They're sequential. Here you can see an example of basically the same question, but the first one is asking categorical information, and the second one would result in continuous data. Before you begin doing any kind of management and analysis, you do want to have your goal in sight. Who's your audience? What are you going to say to them? This will enable you to develop the right path, the right management and analysis path to get you to the end result that you're looking for. As a reminder, I'm sure we're all on the same page about this, but you need to make sure that you're looking at the confidentiality of your data, maintaining confidentiality as you've agreed to do with your clients, with your participants. A couple of key points about that I want to hit this afternoon. First of all, one way to do this is that if you need to keep identifying information, even if it's gender, race, age, that kind of information that doesn't specifically identify a person, but may identify them if someone really thought about it long enough, you might want to keep that information in a separate data set and keep a data set with the information like their participation information or their survey information or their, heaven forbid, their testing information that you can match on unique ID if you want to, but someone hacking into one system or another, one data set or another, wouldn't be able to match those two pieces of data. It's good if you put these on separate, not on the same server, for example, not saved in the same file, but keep them separate. Also, we do a lot of work with student-level information, students in public schools, a lot of protections around that information, and we simply have a rule, don't put any of that kind of information on laptops. No matter how much you pay attention to them, it's just too easy for them to walk away. When you're doing data entry or when you're having somebody else doing data entry, here are some key tips to keep in mind, some common practices, some generally accepted practices for data entry. I want to draw your attention in particular to the importance of using a code book, which is just a fancy way of saying, however you do it, that you set ahead of time your parameters for how you're going to enter the data so that you are following it consistently and anyone else doing data entry with you is also doing the same thing you are. And as you inevitably come across those ambiguous pieces of information, you write those down in some kind of a data log that you can review later in case you need to make different decisions about those. Save often. Save to the past, save to the future. When you've gotten to a certain step, in this case when you've sort of gotten your raw data, if you've done all that data entry, save that file, save that folder, put it aside, don't look at it again unless you really, really need to, and save a new copy of it moving forward into the next step of your management and analysis. And to make sure we're all on the same page about Excel, here is a screenshot from Excel 2010, as I mentioned earlier. A couple of key points about Excel. First, there's two different places that you can enter information into a cell in Excel. You can double-click in the cell itself and type directly into it, or if you just select the cell, you can type into the formula bar at the top of your screen, and here you can see an enlarged view of that. I often find that when I need to cut and paste something out, it's easier for me to do that in the formula bar than in the cell itself. Also, Excel has multiple worksheets. And we do a lot of data sets where we're actually building multiple worksheets worth of data into one workbook that we can have it all in one place. And you can right-click on one of these sheet tabs down here, or you can use the Starburst, I think of this as the Starburst button, to go ahead and add a new worksheet as you build a data set. Perhaps most importantly, Excel is relational. So if you enter a formula into cell C1, in this case A1 minus B1, and you copy and paste it to the next row down, it drags the cell references with it. So in other words, it's not saying Excel isn't thinking A1 minus B1, it's thinking the cell 2 to the left minus the cell 1 to the left. And when you copy that into a new cell, it's still thinking that, but the cell 2 to the left and the cell 1 to the left has traveled with it. If you have any questions about anything we've covered so far, please write it in using your questions feature. And at any point during this webinar, if anything is confusing or if you have a question, please do so. We'll pause a couple of times to see if we can answer those during this hour. Now we're going to move on and specifically explore some data management techniques. First, we want to find out about your experience specifically with data management, and in particular, are you dealing with data from programs, from one program at one site or multiple programs at multiple sites? As you're thinking about what we mean by that, let me give you an example. I work with a school district where I'm getting the same piece of information, so one program type, but at 80 school sites. So I'm tracking information coming from 80 different people at 80 different school sites. On another project, I'm actually needing to get 3 pieces of information, but from 80 different school sites. So are you getting the same information from multiple places or lots of different kinds of information from one place? That is what this question is asking you. Take a moment to pull that in for me so I have a sense of who's doing what. Okay. Thank you very much. So it looks like we've got some folks who are like me, doing multiple programs and multiple sites. So certainly the tools that we're talking about right now are really useful when you're pulling information from many different sites, many different kinds of information. We're going to talk about matching that information, building a data set as part of our data management techniques. And to illustrate that, we're going to do a, sorry, one second. Okay. Great. We are going to do a case study. And the case study that I'm developed for this is we got 4 clinics. We get multiple pieces of information coming from them. The key here, and this is a little bit maybe more idealized from the real world, is we do have the same unique identifier on every piece of information. So a person goes through some HIV test counseling, person goes through an intake process, person participates in a group, person fills out a satisfaction survey. That unique ID shows up on all of them. I know that in the real world we are not so lucky to have that, but for the purposes of this webinar, we're going to go ahead and assume that that is true. The first tool in Excel that I want to talk about is data validation. This is sort of advanced data entry or checking your data after it has been entered. So you're getting data sets from multiple sources. Different people are doing the data entry for you. Can you trust that they have done it right? No, you couldn't trust that you've done it right. You want to check your data entry as well. The data validation tool is a way to do this. In this example, we have at the far right a column called HIV status. The possible responses are 0, 1, and 99 because either they're negative 0, 1, positive, which we code as 1, or it's missing, we code it as 99. We click on the Data Validation tab on the data ribbon, And it pulls up a little window for us here, a dialog box. And I've gone ahead and filled it in here. We're going to allow a list of values because 0, 1, and 99 aren't continuous numbers, so Excel needs to think of that as a list. And in the source column, you could select a range of cells, but what I've gone ahead and done is just listed them out, 0, 1, 99. I just typed it right in there. Go back to, hit OK, go back to your data set, and then go back to the data validation tab. It's a two-step process, and you want to circle all the invalid data. And there you can see on the right-hand side of your screen what that looks like. So you see a 7 has been circled, a blank cell has been circled. Excel has gone through and double-checked your work and told you which ones are out of line from what you've specified. So you can go back to your source information and clean that up. The flip side of this is that you can do that beforehand. So say you're getting a data set from someone and you're double-checking their work, but maybe you want to create the data entry shell ahead of time and send it out to those data entry people. You can specify that that column will only allow the values 1, 0, 1, and 99. It's the exact same process. You just select that column for that variable, allow a list. The list is 0, 1, 99. Hit OK. When someone goes to do the data entry, they'll see that little arrow to the right of the cell that you can see in the first screenshot. And they can click that arrow and pull down the list of allowable values or type directly into it. If you're getting information from multiple sources, you are going to want to track that information in some kind of a data tracker. My rule of thumb is that if you've got data from more than 3 sources, if you're collecting for more than 3 days, and if you have more than one person working on it, you're going to want to use a data tracker to communicate about the status of receiving that data. So this is when you're expecting data from multiple sources in from multiple people, multiple kinds of data. You can see here we've created a allowable list of values that someone could enter in terms of someone you're working with as they receive the data, so everyone is on the same page about the status of it. Now you're trying to build a data set. You've gotten data, say, on HIV testing from all 4 clinics, and you've gotten satisfaction or program information from several of those clinics. You know that there is service information and survey information that contain a unique ID, and you should be able to match that survey with that survey information with that service information. I used to do this where I sorted both sets of data by the unique ID alphabetically or numerically, and then sort of copy and pasted and added extra cells to get it all to line up, and it would take me hours. VLOOKUP is the way to go. This is an example of this is what the VLOOKUP formula looks like. It has 4 elements to it. So this is what you would type into your cell in Excel or into your formula bar. Basically, what VLOOKUP is saying is find that unique identifier in this record, this destination record, then go over to this other data set, the data range that I've specified in this matching data set. Count over find that unique ID over there, count a certain number of columns over, and find me an exact match. That's what false refers to in this case. It means it's an exact match. So we're going to walk through that a little bit. Worksheet 1 is our destination worksheet. We're going to pull in the matched values into worksheet 1 from our match worksheet, which is worksheet 2. Here's what the formula looks like in this case. And I wanted to take a moment to talk about those dollar signs. Earlier, we mentioned that Excel is relational. As you copy and paste a formula or autofill a formula down in a data set, it adjusts all of its cell references. For VLOOKUP, we don't want it to adjust the data range that we're matching on. We have specified the entire data range that we want Excel to search for that unique ID, that matching unique ID. We don't want it to shift that data range around. We were very clear about it. So we use dollar signs to lock the column and the row, and then the column again and the row again of the last cells to lock the whole data range. You can use a dollar sign to lock just columns or just rows, but in this case we want to lock the whole thing. And this is specifically in contrast to the very first element in our VLOOKUP formula, which is the cell in the destination worksheet that contains the unique ID. Obviously, we want it to match on the new unique ID as we pull it down to each new record, so that we want to keep the cell reference moving with the formula. Here you can see what worksheet 1, which is our destination worksheet, the first few records looks like once we have done VLOOKUP in column I for question 01. And here you can see that it has pulled information from the match worksheet regardless of the order that it appears in the match worksheet. So it found 10100 and stuck it in, and then later it found an earlier unique ID and stuck it in the right place. So you don't have to sort it ahead of time. It does all the looking up and the sorting for you. It's brilliant. At this stage, please, as a reminder, chat in any questions that you have about anything we've talked about so far. And also, once you've done this kind of ginormous match, you definitely will want to save. So if you're matching multiple data sets, you probably want to save every time you run a VLOOKUP, because VLOOKUP is wonderful. It works really great, and it's a little bit finicky. So once you've gotten it to work right, you definitely want to save your data set, even if you're going to do another match immediately following. And then save a copy to move forward into whatever you're going to do next. In this case, we're going to create some new variables. Concatenate is absolutely one of my favorite formulas in Excel. And it's totally simple. Concatenate merges text fields and any additional text that you want to create a new text field. And I have used this to create unique IDs countless times. I get a set of surveys from Clinic A, and some very helpful person has done the data entry and numbered the surveys 1 through 100. And I get a set of the same survey, but from Clinic B, and someone's been very helpful and numbered the surveys 1 through 50. So now I have 1 through 50 twice, from 2 different clinics, 2 totally different sets of people. I use Concatenate to designate designate the data source and the unique ID together, to merge those together into a new unique ID. Here we have patient ID where someone has maybe overlapping patient IDs from one clinic to the next, but I need to create a new patient ID that specifies the source clinic. Bear with me while I retake control. There we go. Here's an example of what that formula might look like in Excel. You can sort of add several pieces of text. That's why we've got that dot, dot, dot in the middle. You can add 50, I don't know, lots of pieces of text. I've never maxed it out yet. Here's what the formula looks like when you actually type it into the formula bar. And clinic underscore A underscore is my text that I've written in, and I've put it in quotes to tell Excel, I want you to actually enter this exact text, comma, A2, which is referencing the patient ID cell in this record. So it immediately puts in clinic underscore A underscore 147800. It's merged my text that I've written in quotes with the value in the patient ID column. And you copy and paste that all the way down, and it pulls it forward for everybody. But what if you get information that you want to split up? Earlier we did a poll where we asked you to select all that apply. And you can select, it looks like a multiple choice question, but when you're analyzing data like that, it's actually a series of yes or no questions. If you check it, it's a yes. If you don't check it, it's a no. What if you got data that someone had that question, and you coded each response as sub-question 1, 2, 3, and 4, and someone sent you a data set back that had in one cell, in one variable column, the following value, 1, 3, 4. So you checked 1, 3, and 4. Well, you'd want to separate those out. You would use text to columns for that. The example we're actually going to use is a little bit different. We're going to use a first and last name example because I think it's easier to see that way. The text to columns is not a formula, so you don't open it with an equal sign and write something and then select a data range. Rather, you select a data range, so you'd highlight that column. In this case, it'll be first and last name. You'll see that in a moment. And select the tool, text to columns from the data ribbon. That opens up a 3-step wizard. The first thing you need to do, and it shows you a preview. You can see our first and last names here. I think this is from Civil War records. This is names pulled from there, which is why they're so, I don't know, so 1860s. But you first tell Excel, is it delimited? yes, there's something that separates these pieces of information that you want to divide it up into. It is delimited, and here we can see a preview of the selected data. Step 2, you tell it how it's delimited. In this case, there is a space. Once you click on space, it continues to adjust the preview given the information you're telling it. Now you can see a column of first names and a column of last names. And then you can format each column. General or text is perfectly fine in this case. You could also format something as a date, depending on what you were working with, what kind of data was entered in together, smooshed together into one column. Data trackers, using VLOOKUP to match information, using Concatenate and text to columns to create new variables or break up variables that have been put together when they shouldn't have, and you need to pull them apart. Those are all key steps in managing your data, getting it ready to do your data analysis. Before we move on to the data analysis section, I wanted to ask you all to pull in one thing that you think might be wrong about this data tracker. If you were using this, what is something that you might do differently in this data tracker? Take a moment to do that, and I'm going to go ahead in a moment and look at the, what am I looking at? I'm looking at the agenda next. That's where we're going. But I want to make sure you have a chance to review this and chat something in if you would like. All right, we're starting to see some ideas. And I'm going to go ahead and move on to our agenda. You guys can keep adding things that you want there. OK, moving on to data analysis. First, we're going to review some really important Excel formulas that you can use for data analysis. Flipping through my notes. Now I'm here. OK. In the basic data webinar, basic data analysis webinar, we talked about a lot of these kinds of calculations that we'd want to do. We want to find the average, the mode, or the median of a data set. We didn't talk about sum, but sum is certainly a formula that I use a lot to do different kinds of calculations. These are your pretty straightforward Excel formulas: equal sign, the name of the operation that you want it to do, and then a data range. You select the data that you want it to perform the operation on. We're going to explore, like VLOOKUP, a couple more complicated formulas over the next few slides as well. Say you want to count up how many times a given value occurs for a given question. This is a pretty common task when you're doing data analysis, setting up a table of frequencies. And we went over this sort of more manually in the basic data analysis webinar. In Excel, the COUNTIF formula is very useful when you're creating your table of frequencies. COUNTIF, you can see at the bottom of your screen, COUNTIF has two elements: the range, or the data range, and the criteria. What is the thing that you are counting? And it's also worth noting, I don't think we've brought this up before, that if you start to type in a formula in Excel inside of an actual cell, if you've double-clicked in a cell and are entering it in, at least in the more recent versions of Excel, it pulls up that generic formula that lists the different elements. And depending on where you are, it actually bolds the element that you're currently specifying. So it helps. It's a little bit of a sort of a mini guide as you're creating your formula in Excel. In this case, we have told it to look at the cell range N2 to N18, which is also, you can see, highlighted in the blue square. And we're asking it to count the criteria. The criteria is 2. We're asking it to count the number of times 2 occurs. If we do this by all of our survey questions and all of the possible values, which for our survey question is 0 through 5 and also 99 if it's missing, we can create a frequency table. So underlying this is simply a series of COUNTIF formulas. You can cut and paste those and just adjust the cell references if they don't adjust automatically, and it's pretty easy to build this. Another tool in Excel that sort of does that similar kind of thing where you fold up a bunch of data into a new table that returns counts or percentages is a pivot table. I always think of a pivot as pivot table is, for a long time I thought it was changing your columns and your rows, but no, it's sort of a folding up. It's more of an origami kind of a thing. It works really well in Excel 2010 or Excel 2011 for Macs, not as well in earlier versions. So please feel free to explore it in earlier versions, but it definitely does get a lot easier in Excel 2010, Excel 2011 for Mac. So if you are trying to do it in earlier versions and it's frustrating, you are certainly not alone. Here is an example of a pivot table that we have created and that we're going to walk through the steps towards creating. In this case, we're looking at gender by the 4 clinics. How many people responded to some survey by certain genders at 4 clinic sites. First, we highlight the clinic and gender columns, and then we click Pivot Table on the Insert ribbon. It will pre-populate our data range, but we could have gone back and done that after the fact, but I like to select it ahead of time and then insert the pivot table. And in this case, I recommend putting your pivot table into a new worksheet. I don't know about you, but I sometimes reformat rows and columns, and I insert rows or I insert columns, and if your pivot table is sitting in the same worksheet as your data, then all of those actions are going to mess with your pivot table. So just put it in its own worksheet. It'll sit there. It'll be nice and clean. Here we have an example of how you can use the tab to the right of the table range to select a range. But like I said, we've already done that. Once you've selected a pivot table, it opens up the new worksheet in this case, where you can see the pivot table actually being built. And that's what you see sort of right in the center of your screen, Pivot Table 2. We haven't started building yet, so it just looks like some funny little icons. But on the right is the Pivot Table field list. You can see our 2 fields, clinic and gender, have automatically been added to our field options. Sorry. To create this pivot table, you would use simple click and drag. You would click clinic down to the row labels field. You would drag gender down to the column labels field. You would drag gender again to the values field, and it would build this pivot table that you can see here. At this point, it's counting the number of females who filled the survey out for Clinic A is 34, or for different people of different gender who filled out a survey for the 4 different clinics. But we might want to see this as a percentage of row, percentage of column, or even a percentage of the whole table. You would go back to the field list and click on the arrow that will now appear next to gender in the values box. On the pull-down menu, click Value Field Settings, and it opens up a wide variety of different ways that you can display the information. You can, first of all, you can summarize the information in different ways as a sum or a count. What we were seeing before was a count. You can also click that other tab you can see there, Show Values As, and that's where you would find percentage of row or percentage of column as a way to display your values. Here you can see the completed pivot table and the pivot table field list that matches it. Once you've created your pivot tables, you would want to save. I'm actually going to go back to the pivot table for a second. Hold on. We've been focusing a lot on some of the technical aspects of using Excel to create, summarize, or match, or use information, work with the information that we're getting. The key point of data analysis, of course, is not the technical aspect of it, although that is important. The key point is to then sit down and look at the data and interpret it. So if you were looking at this pivot table, what are some of the things that you would notice? What is the stuff that stands out for you? One thing that you would notice is a lot more male gendered people filled out the survey. You might also notice that not many people filled out the survey at Clinic D, for example. There are other things in this pivot table that might stand out to you depending on your context, depending on the programs that you're running there. once you've used the technical skills to build this kind of view on your data, this kind of look at the data, it's certainly the next step, and the most important step is actually to build your interpretation of it, to remember the context of your program, to remember your evaluation questions or your objectives or your logic model, whatever you're working with. What is important about this information? What does this tell you about your program? And whether or not you're meeting your goals and your objectives in the way that you want to be meeting them. So now, save your information. Save it to the past, save it to the future, as we've said already. And please, as a reminder, if you have any questions, feel free to chat them in to your questions, using your questions feature, and we will take a look at those and get back to you by the end of the webinar, if we can. I wanted to walk through a couple of objectives that are similar to objectives that I have seen in my own work with schools, with health information, with health education, with teenagers. Walk through these two different kinds of objectives that look similar, but talk about the different ways that we're going to analyze them. This objective is getting at something we're going to be analyzing continuous data. So let me talk, and that makes a difference and actually makes it easier to analyze. So let me talk about that. The objective, well, the program is you are running a group, training people to be better at communicating about safer sex, better about communicating about using a condom, and they take a self-assessment at the end of the workshop. You've promised a funder that 75%, that the average score on the self-assessment will be 75% or higher among the people who've gone through your community education group. The self-assessment is scored on a 100-point scale or on a percentage scale. So you simply take the average of all of the condom use scores or the communication scores. And in this case, in this sample data set, we come out with the average of that entire column is 75.30%. Our objective was get it to be 75% or higher. We have met our objective. Because we're talking about a 100-point scale, a percentage scale, it is continuous information. We were able to simply take the average of the scores. This objective is a little bit different. In this case, 80% of participants, a count of participants basically, will show a 5 percentage point gain or better from a pre-test to a post-test in your groups. In this case, that 5 percentage point gain really means they've done 5 percentage points or better. Really means that yes, they've met your criteria, or no, they haven't. So we're going to create a dummy variable first to mark each record individually. Yes, this record met that criteria, this person. No, this record or person did not meet the criteria. Dummy variable is not a stupid variable. It's more like a ventriloquist dummy variable. It speaks for that record. You have done the thinking, oh, does this record meet the criteria? And you've marked it as such. Then later, you can go back and figure out if 80% of your participants met that criteria or not. We're going to walk through how to create the dummy variable. First, you've got to find the difference between pre- and post-test if you haven't already. That is a simple one cell minus another cell formula in Excel, copy and paste it all the way down. It's relational. It updates the cell references as you go. Great. Now we have the difference in the pre and the post. Now we need to figure out how to insert the dummy variable for yes, there was a 5% gain, or no, there was not. You can look at each individual difference and tell, but we're going to go ahead and give that record a name of yes, it met, or no, it didn't, the criteria. And we use the if formula to do this. The if formula has 3 elements, as you can see here. I'm sorry, go back to that. The first element is something true? And if it's true, enter this value, and if it's not, enter this other value. In this case, the way we're actually going to word it, because it's a little bit easier, is the difference less than 5%? If so, it didn't meet the criteria, so enter 0. If it isn't less than 5%, in other words, it is greater than 5%, mark this record a 1. And because we're dealing with percentages, we're using a decimal here. I hope that is pretty straightforward for everyone. It's not 5%, it's 0.05 in this case. Here's an example of what that formula is going to look like in Excel itself. And we copy and paste it all the way down, and we generate a series of ones and zeros. And you can see that that first record, 27%, yes, they meet the criteria, but a couple records down, we've got some folks who lost points from pre to post. They obviously did not meet the criteria, and they are a 0. The great thing about a dummy variable that where something is yes, true, or not true, you use 1 to indicate true or met the criteria and 0 to indicate it didn't, is at this point you just take the average of all of those 1s and 0s, use that average formula, you can see that here on your screen, and it returns a decimal in this case because it's going to be some point between 1 and 0. Format that as a percent, and that is your percent of respondents who had a 5 percentage point gain or higher. Going back to the original objective, our goal was 80%. In this example, we reached 77%. 77% of our participants had a 5 percentage point gain or better. We didn't quite meet our objective, but we found how a pretty straightforward objective actually has several steps. There are several steps in the process of getting the answer. Did we meet that objective or not? Would love to know about an example of a dummy variable that you might need, that you might use in working with the data that you're working with. I'll give you an example from my own work as well, just to broaden our thinking about this, hopefully. We use a dummy variable in place of English learner status when we're working in schools. So if you're a designated English learner, you're a 1. If you're not, you're a 0. And we do some calculations where kids, the educational goal is to have kids be redesignated from English learner to English fluent, from 1 to 0. And we can do some subtraction there to sort of figure out if a given person has met that criteria or not, has been redesignated, and then do some percentages, do some analysis on the resulting variable that helps us understand redesignation rates. So in that case, that's an example of a different dummy variable that I use a lot in my work right now. Last, and I was just using this in something else this week, a heat map. A heat map is a really great way to get a bird's eye view on your data. So I use this both as an initial tacit analysis to help me guide where I want to take my analysis, what questions I want to look at. I also then sometimes use this to do reporting. So I'm working with someone, I want them to get the bird's eye view as well. I'll heat map something so it's easy for them to see the different amounts of times different values for a given variable occur. So what a heat map is in Excel is conditional formatting. In this case, we're going to look at using a heat map on a satisfaction score. So we're doing a survey of people who come to our clinic, and we're asking them, how satisfied are you with the services on a 1 to 5 scale. And we're doing a heat map on those responses where 1 is red and 5 is green, 5 being positive. Like I said before, it's conditional formatting in the current version of Excel, the most recent version of Excel. You can find that right on your home ribbon. And in this case, I'm setting it to do a 3-color scale where red is low and green is high. And it has preset color scales, but you can also dive further into conditional formatting and set your own color scales as you wish. In this case, it's highlighted the ones with red and the 5s with green. And if I was looking at this and I wanted to have positive satisfaction among my clients, this would make me worried. There's a lot of red here. There's a lot of yellow on the 2s here, not as much green as I would like. And if I were showing this to someone else in my organization, I think that they would share that concern with me. So like I said, a heat map is a really great way to get a bird's eye view on your information. I recently, thinking about a heat map, the example that I was using this week is we were tracking some data. So it was a combination of a data tracker and and a heat map where we heat mapped on a data tracker to return it to someone who was responsible for getting the data for us to show them exactly how much was still missing. The missing information was heat mapped with red, and the received information was green to get them to sort of nudge them along to continue to collect it. We are coming to the end of the content of our webinar, and I wanted to give you another opportunity to chat in some more information about yourself. In this case, what is something that you would take away from this webinar to improve your data management and analysis? You know, the VLOOKUP was mind-blowing for me when it happened, when I first learned about it, but I don't know, there might be something else from the webinar, from the data management section or from the data analysis section that feels particularly relevant to you right now in your work. If you could please chat in something that you are going to take away from this webinar to improve your data management and analysis, we'd love to get a sense of what stood out for you today. We've pulled together a couple of different resources that we think are really helpful, especially with Excel. There are a lot of great resources out there, and in truth, the Microsoft website, Microsoft is a big corporation. They are funky in a lot of ways, but they have a lot of online training, and they have training for different levels, for different kinds of uses of Excel, for specific tools in Excel, such as the pivot tables, which you can see about the fourth resource down. YouTube also has an Excel Basics series, which is a lot of fun and walks through several different Excel features. And finally, lynda.com is a paid resource that I've used before for some really high-quality, in-depth Microsoft Excel tutorials. Like, it's hours of tutorials on Microsoft Excel. But it is paid. I was able to use it because I got a free pass somehow or other, and I don't know, they might be giving those out if you sign up. You get the first 30 days free or something. So it might be worth checking that out, especially if you want some real in-depth training on a specific aspect of Excel that you can take a couple hours over the next month and look at that. And I'm going to turn the headset back to Sonia to give some more context about the other upcoming webinar.
Thank you so much, Jess, for that presentation. We know we've covered a lot of material today, and we do have about 15 minutes left in our time together. We really want to allow that time for some very specific questions and answers, really based on what you would like to learn more about from the stuff that we've covered today. We also recognize that we cruised very quickly through a lot of information, so don't worry about remembering it all. There is a brief information sheet, like a written document, that's available in our online resource library, as well as online training modules based on this exact same content. So it's actually 2 online training modules, one on the data management pieces and one on the data analysis pieces. So those training modules will allow you to go through this material, this exact material, at your own pace if you want a refresher on it. We will also post the recorded version of today's webinar if you want to just listen to it in its recorded version. It'll be available on our online training, online resource library as well. And as Jess mentioned, that this was part of a 3-part series. So for anyone who found this to be a little bit too fast for their comfort today, we really encourage you to go back and take a look at that basic data analysis webinar. The recording of that is online, as well as the information sheet, as well as the online training module. And if you are hungry for more, part 3 of this series is coming up on May 23rd. We'll be really focusing on how to communicate data, and particularly how to use charts and visual representations and some best practices around visual design and what we now call the field of data visualization. So presenting data in a way that is most easily understood by others. So that's what's up and coming as a part of this series. I'm going to go ahead and put back on the slide that just shows the link to our online resource library. We also offer individualized capacity building assistance. As I said at the beginning of today's webinar, we're funded directly by CDC to provide free capacity building, so we actually can work individually with organizations one-on-one to give you more support around your monitoring and evaluation and data management and analysis needs, but also around other things that support the organizational infrastructure as well as the evidence-based interventions and public health strategies that organizations are implementing. So we have a little bit of time here for questions and answers. If anyone would like to ask a question live, you can click on your raise your hand icon. It's the little green hand on your webinar control panel. We can actually call on you, unmute you, and you can ask your question live. Or you can use the questions box in the lower right-hand side of your control panel to chat in a question. And we can go back to that section of the webinar or talk a little bit further about any of the myriad data management and analysis tools that we've talked about today. So I'm glad to see that folks are feeling excited about some of the things they learned in today's webinar. Folks shared that they are excited about VLOOKUP, that they're excited to use formulas like Concatenate and COUNTIF. A couple of people mentioned heat mapping and pivot tables as things that they're excited about. Dummy variables. We do have about 10 more minutes together, so if people have questions about what's been covered or would like us to go back and talk more in detail about any of those data management or analysis topics, we're more than happy to do so. You can click on your raise the hand icon or chat your question in the questions window.
This is Jessica again. I just wanted to reference a couple of things that people chatted in and then also bring up a couple more formulas, make sure people are aware of them that I didn't create slides on. First, some folks chatted in some different dummy variables, and I think that sort of gives you more information about the breadth of how you could use them. And one is someone came to at least 4 of 5 workshops. So you can use a formula to count. You can use COUNTIF to count how many if you designate they came or they didn't as a 1 or a 0, so that's already a dummy variable. Then you can use COUNTIF to count up the number of those across those 5 dummy variables, and if it's 4 or more, then you create a new dummy variable saying, yes, they came to 4 or more of the workshops. So it's a dummy variable on top of a dummy variable on top of a COUNTIF formula. And another one was 80% of people come back for their test results. So in that case, the criteria is did they come back or not. You create a dummy variable on that, and then you can just do the average of that series of 0 or 1, yes or no dummy variables and come up with your average. The 2 other formulas I want to make sure people know about in Excel, because in particular, VLOOKUP is one of the formulas we talked about today for matching data sets, and this can get in the way of VLOOKUP. If you're matching on a unique ID and someone has entered some leading spaces or some trailing spaces, it's not, but you're matching it on a data set where there are different kinds of trailing or leading spaces. You won't see it in your Excel spreadsheet. It might not be obvious that they're there, but your VLOOKUP won't work because it's looking for an exact match, and the spaces make it not exact. So you can clean and then trim. Those are 2 formulas that remove the leading and the trailing spaces in your unique ID and trim it down just to the characters that you're trying to match on. So you clean it first, that gets rid of the first ones, and then you trim the cleaned ones and it gets rid of the trailing ones. And then that point you've got a unique ID that really will work in a VLOOKUP. So I want to make sure people know about those. Let me know if there's any of the slides that you want to go back to. We can review them. When I was practicing for today, it took a lot longer to get through these, and I was trying to trim it down. But if I went through anything too fast, please do let me know.
Well, it doesn't look like we're getting any more questions coming in. So if folks do have questions, please click on your raise a hand icon or chat it in your questions feature. If there aren't any more questions, we'll go ahead and close out today's webinar and just direct you again to the recording and the online training module, that are all in the online resource library at the address up on your screen, the library.capacityforhealth.org. And then just as one final reminder that why do I keep doing that? One final reminder that this is part of a 3-part series, and that the 3rd part of this series will be coming up on May 23rd, and that will be the data visualization webinar. So sorry, I keep messing up our slides. So we'll just go ahead and leave that up on the screen, and if we're not seeing any more questions coming in, we will go ahead and close out today's webinar. So thank you all so much for joining us today, and we look forward to seeing you on part 3 on May 23rd.